Okay. Your excursion, long excursion is even, and rise and fall is equal on both sides bilaterally. Can you turn around, please? Okay, so what I'm going to do now is I'm going to listen to your lungs. Okay? Now, each time I place my stethoscope on an area of your chest, I need you to take the deepest breath you can. Do not hold your breath. Just take it in through your nose and let it out through your mouth, okay? Okay, and I'm going to start closer to your neck area, and I need you to take a deep breath. Okay? Okay. Okay. Breathe in. Okay. 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 Okay, now I need to listen on this side. Breathe in. Okay. Now I need you to turn that way, and I need to do your back. The same thing. When you feel the stethoscope touching your back, you need to take a deep breath, okay? Go ahead. Go ahead. Breathe. Okay, and over here, raise your arm a little bit. I want to get the, breathe in. Okay, you can turn around. Your lungs are clear bilaterally. I don't hear any rhonchi. I don't hear any wheezing or any wet rails, okay? No adventitious lung sounds. Your chest is rising and falling equally. So your lungs are good. Now, what I need to do is I'm going to situate this picture, this pillow, and I need you to lay back a little bit. Okay. Let me take your blood pressure. While you're laying down, put your arm up. Okay. I'm going to listen to your heart, but I want to get your blood pressure first. Okay. I'm going to see how good your circulation and your peripheral circulation and things are. Okay. Okay, your blood pressure is 118 over 82. And that is good. Okay. And your respirations are easy effort and a 20. Okay, so now what I'm going to do is I'm going to listen to your heart. Now, in order for me to do that, I have to go under your t-shirt and I have to touch a couple of different spaces, and I have to do it twice using my diaphragm and my bell. Okay, I'm going to start with my diaphragm first, and I'm going to go through everything, and then I'll start back over. Okay, but first what I need to do is I need to bend down, and I'm just going to make sure you don't have any lifts or heaves. No lifts or heaves noted. Okay, so I'm going to start at your second intercostal space at your right sternal border. Okay, and your second intercostal space, left sternal border, which is your pulmonic. The first space I listened to was your aortic. Now I need to go down to your third intercostal space, which is called your Erb's point. Okay, in the fourth intercostal space, left sternal border, which is your tricuspid. And also your fifth intercostal space, which is your mitral valve. And I'm going to listen here for a minute to get your pulse, okay? Your apical pulse. Okay, your apical pulse is 73. And then you notice that last time, in order to get the apical pulse, I have to listen at the fifth intercostal space, mid-clavicular line, midline. Okay, so with using my diaphragm, I hear your S1 and S2. Your heart rate is regular. I hear no splitting, no murmurs, no extra sounds. Okay, so now what I'm going to do is I'm going to use my bell, the small part, and this is a more defined hearing. Okay, so we're going to do everything we just did over again. Okay, and so I'm going to start again at the second intercostal space, right sternal border. Okay, and the second intercostal space, left sternal border. This is your aortic valve, and this is your pulmonic. And then the third intercostal space, which is going to be your Erb's point. Okay, in the fourth intercostal space, which is your tricuspid. And again at your fifth intercostal space, mid-clavicular. Okay, and again I hear no splitting. Your S1 and S2 are normal. They're audible. Your heart rate is strong and regular, and no splitting noted, no extra sounds. Okay. Okay, so now what I want to do is I want to look at your abdomen. So if you can just lay your hands down like this, I'm going to have to expose your stomach, but I need you to keep that like that so that we don't expose anything else. Okay, and I'm just going to raise your t-shirt up a little bit, okay? Okay, so first I'm going to look, and looks like you have a rounded abdomen. It doesn't appear to be distended. I notice you have a belly button ring and a little scar right there from a surgery and a tattoo on that side. Okay, so I'm going to bend down and let me look and make sure you don't have any noted peristalsis or any pulsations noted. And I don't see anything. The color is homogeneous. Everything is around the same color except for that little scar right there. Okay, so what I'm going to do, I'm going to start with listening. Okay, so you don't have to do anything but lay still. And I'm going to listen to your stomach, each quadrant. And I'm listening for bowel sounds. Okay, your bowel sounds are active, normal active in each quadrant. I don't hear any extra pulsations or any pulses or anything in there. Now what I want to do is palpate your abdomen, and I'm going to start with a light one-handed palpation. What I need you to do is let me know if you feel any tenderness, okay? And while I'm touching, I didn't want to do this at first because I didn't want to disturb the bowel sounds. So I just want to look inside your belly button just to make sure you don't have any drainage. I do see a scar there. No drainage. The color is good. No redness noted. Also, your piercing looks okay. No redness or swelling noted there. And it is midline. Okay, so now I'm going to touch you. Let me know if you feel any tenderness, okay? Any tenderness? No tenderness? Okay, now I'm going to do a deeper palpation, okay? That way, doing it light, I didn't feel any masses. I didn't feel any organs. You really wouldn't feel it with a light palpation, but if it's really enlarged, I would. And you had no garden, so I can tell that it really wasn't hurting you. But now I'm going to go deeper, so you let me know if you're feeling any discomfort, okay? In this area, I'm going to feel for your liver, and I don't feel your liver, so that means you don't have any organomegaly. I don't feel any masses. You're not guarding, so you're not having any tenderness, right? Okay. 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 All right. Now I'm going to cover you back up. So your abdomen is normal. No enlarged spleen, no enlarged liver, no tenderness, no guarding noted. Okay, so now what I'm going to do is I'm going to go to your lower extremities. And the first thing I want to do is I want to feel the temperature to see, you know, if you're getting adequate blood flow to your feet. Okay, so I want to just touch like this. And it's nice and warm. Okay, now can you lift one leg up for me? And I want to feel your legs, and they are nice and warm. Okay, can I see the other one? I kind of want to do both of them at the same time. Can you lift both of them? That way I know they are warm and they are both even in temperature. And they're nice and warm. Okay, you can put them down. Your color is good. Your skin is smooth. No dryness noted. Okay. Your range of motion is good in your knees. You're able to bend them adequately. Now what I want to do is I want to feel your pulse behind your knees. Your popliteal pulse. Just make sure they are, no, you can lay them straight. Make sure that they are strong. So they're about 3+. And they are also even. Okay, and now what I want to do is I want to feel your pedal pulse. Okay, and they are about a +3 or 3+. They're nice and strong. Okay, and now I'm going to also check your capillary refill. And again, you have polish on your toes, so I'm going to push your cuticle. I'm sorry. Just hold your head, your feet still for me. And I'm just going to touch each one just to make sure that the color comes back. Your cap refill is less than 2 seconds. Color returns back normally. Okay, so now what I need to do, I need to push on your feet, and I need you to push back. I'm going to test your strength on your feet to see how strong that it is, okay? So I'm pushing, you push back, push back, push back, okay? That's about a 5+, very strong feet. Let me wash my hands and touch your feet. I want to check your edema on your ankle. Can you put your feet in? Okay. And you don't have any edema, and that's a good sign. Okay, stand up for me. Just washing my hands again, just since I was close to your feet. Okay, so what I need you to do is, okay, I'll hold this up so you can pull your shorts down a little bit. Okay, so I need you to come to this area. And what I'm going to do is I'm going to have you to turn around sideways. And I want you to bend down as far as you can. And when you bend down, I'm going to feel your spine. And I'll tell you what I'm looking for when you bend down. Can you bend down for me, please? Can you bend down a little more? Okay, so what I'm looking for is from here to here, that your spine is nice and even. No lordosis noted, no kyphosis, and no scoliosis noted. Your spine is nice and straight. And so now I'm going to push in. You tell me if you feel any tenderness.